Elsewhere, Bauchi State Health Contributory Management Agency, in collaboration with a non-governmental organization, Journalists for Public Health and Development Initiatives, have organized a one-day training for media practitioners working in Bauchi with the aim of enlightening them on the operation of the agency and the Bauchi State Health Contributory Scheme. Our Bauchi State correspondent Awal Hassan observes the critical role of journalists as stakeholders in the health sector, as described by the Executive Secretary of the agency, Dr. Mansur Dada, and now completes this report.
The Bauchi State Health Contributory Management Agency, BASHCMA, is at the forefront of improving universal health coverage. It seeks, among other objectives, to provide easy financial access to healthcare services, ensure continuous improvement of the quality of healthcare services, as well as to improve private sector participation. In order to achieve the state objectives, there is the need for proper dissemination of information, and this is what informs the decision of BASHCMA to organize this training for journalists.
What we want to, the information we want to pass is about BASHCMA and the scheme, and we are expecting each and every one to be aware. So we are actually training you so that you can pass the message to the general populace of Bauchi State about the Bauchi State Health Contributory Scheme and all its programs.
The Bauchi State Health Contributory Scheme has 3 basic programs which are all beneficial to the general public.
So we have the formal sector program, we have the informal sector program, and we have the vulnerable program. We have already started the vulnerable program. The vulnerable program has now a cover of about 52,000 people across each and every ward of the 323 wards across the state are now benefiting from this service for the past 18 months. So that is the vulnerable program. We have started the informal sector. I think we have reached around 150 people that are benefiting from the informal sector. What we are about to start now is the formal sector. The formal sector is the one for the local state and local government workers. Okay? That's the state and local government workers. So that is what we are planning to do.
To effectively achieve universal health coverage, resource mobilization is another key factor that will help in the proper funding of the program.
The larger amount of money that we're going to come for the success of this program is going to actually come from government for the enrollment of the vulnerable. While also the private sector, as part of private sector resource mobilization, they can also contribute to the enrollment of the vulnerable population, either through Adopt a Family initiative or through philanthropism or through religious bodies can come together, or either zakat or any of those funds that are available to help the needy.
Participants are drawn from various media outfits, including community radios, who play critical roles towards informing the grassroots populace, and Viewer Television was part of it. Awal Hassan, Viewer TV News, Bauchi.